Emergency signs for adult patients. These include an obstructed airway or a patient not breathing, seizure current, a facial or inhalation burn, hypoglycemia with a glucose less than 3, and cardiac arrest. In summary, when asking for the presenting complaint and looking for emergency signs, if any are found, the patient is taken straight to the resus area. We do not calculate the twos or do any additional investigations or tasks. If no emergency signs are present, we proceed to look for very urgent and urgent signs. Very urgent signs for the adult patient. High energy transfer or severe mechanism of injury. In our context, this refers to excessive acceleration or deceleration injuries. Examples of these are a fall from a height of more than 2 meters, a high-speed motor vehicle accident of more than 50 kilometers an hour, shortness of breath acute, and a level of consciousness reduced or confusion. Coughing blood, chest pain, a stabbed neck or chest, hemorrhage uncontrolled. This would be an arterial bleed. Seizure postictal. This refers to a patient who has had a recent seizure but is not fully alert. Focal neurology acute, including a stroke or a new onset of a left or right-sided weakness. Aggression. Threatened limb. This refers to any acute insult leading to a pale, pulseless, cold limb and includes a sensory motor deprived limb. Eye injury. Dislocation of larger joint, not the finger or toe. Fracture compound with a break in the skin. Burn over 20%. Electrical burn, circumferential burn, chemical burn. Poisoning or overdose. Diabetic with a glucose over 11 and ketonuria. Vomiting fresh blood. Pregnancy and abdominal trauma. Pregnancy and abdominal pain, as well as severe pain. Severe pain is unbearable, the worst pain the patient has ever felt. It may be difficult to assess, but in most cases it is associated with sweatiness, paleness, and an altered level of consciousness. Moderate pain is intense but bearable, and mild pain would be any other pain. Remember to make a pain assessment on every patient that you see, because globally pain is not assessed and treated very well. In summary, after identifying a very urgent clinical sign, commence to calculating the twos and checking for additional investigations. Your triage process is only complete once you have personally handed the patient over for further appropriate management. Urgent signs for the adult patient. Hemorrhage controlled. If a patient presents to the emergency center with an active bleed and you apply direct pressure to the site of trauma and are able to control the bleed, this would be considered an urgent sign. Dislocation of finger or toe. Closed fracture with no break in the skin. Any other burn smaller than 20%. Abdominal pain. Diabetic with a glucose over 17 but no ketones in the urine. Vomiting persistently. What is persistently? This would refer to a patient vomiting in the triage area or in the waiting room. Pregnancy and trauma. Pregnancy and PV bleed. And lastly, moderate pain. In summary, once an urgent clinical sign has been identified, continue with the twos calculation, check for additional investigations, before assigning the final triage priority level. Then continue with additional tasks and hand over to the senior healthcare professional.